I've had hip pain for a really long time, and the more and more I run, the worse it got. And so we decided to start doing physical therapy, and then things weren't getting better. When I saw my physical therapist, she was like, I think you have a labral tear. And so I ended up seeing Dr. Haber initially for my right side, and he also encouraged me, okay, let's continue on with physical therapy, and then if it doesn't get better, then we could think about surgery. I also had left side tear, and ironically, when we went with my left side, I actually, it was a really odd MRI. It came back with 2 different stress fractures in my lesser trochanter and my sacrum, as well as like osteotitis pubis and tears as well. And I remember that appointment vividly. I truly just like started crying and was like, I can't imagine, like this is not what I was expecting. And Dr. Haber met me with so much care and empathy and just sat there and listened to me and really made me believe that this wasn't an end to my running journey, that it actually was the beginning. So it was about a year-ish, a little over that, of kind of, all right, let's rest, let's try PT, and kind of this gamble of, will this work long term? And every time I went back to running, within 4 to 6 weeks, it just, nothing was feeling better. And so I remember going back, and he was like, if we want to continue for you to move in the ways that you want to move and run and hike and be active, then surgery might be something that we consider. So I had my right side done in May of 2023, and then my left side was recently December of 2023. So both of them I had cam impingement, so shaving down the femoral head bone, as well as tears, and the right side had some arthritis slightly beginning to develop. I definitely didn't rest like I should have. I learned a lot from the first surgery to the second in regards to nutrition and making sure that I was still fueling my body even though I wasn't moving. I think also having a doctor who knows that I'm the person that's gonna overdo it and call me out on that and say, you need to rest, I need tough love, and he was there to give me that empathy and also that tough love. The second one felt like a night and day difference. I kind of knew what I was getting into, and knowing that, oh, this pain's normal, or this little twinge that I feel, or my hip flexor feels really tight. I know what to do in these situations, and just knowing that I would be okay and just trusting my body that it would heal. I started running when I was 8. So never ran competitively, but running was always a form of therapy for me. And so yeah, not being able to run was definitely challenging. It was the longest I've ever taken off of running. And I feel like with both my physical therapist and Dr. Haber, it was the first time that I felt seen and felt like I could truly trust a care team. And I'm now running about 2 to 3 times a week, about 5-ish miles, and I'm gonna be running the Bolder Boulder. I'm just so excited to even be able to be at a start line. Thank you truly for giving me my life back and helping me to move in ways that I never thought was possible.